my next three speakers, I'm going to have to ask them, and I hate to do this, but if you could, really look at fine-tuning at this last minute your talks, because we've really fallen significantly behind, and we aren't going to catch up, but if we can at least, pick up a little bit on it, so we can get, out here before our reception tonight. The next speaker, is Tim von Dohlen, and Tim is going to begin our discussion with culture of life medical centers and how they're important, have been a part of our healthcare reform is. And a little bit about Tim. He's married to Patricia, who is here with him today. They have 73 years of marital experience. Their combined family includes 3 grown sons, 2 daughters, and 15 grandchildren. The same number that Peggy and I have. A graduate of the University of Texas at Austin with degrees in pharmacy and law. Current business includes investment group with focus on healthcare, developing new nursing homes with offices in Austin and Goliad. I don't know if I pronounced that right. He's member of board of directors of the Texas Medical Foundation, Quality Improvement Organization, Texas Health Institute, and San Diego High School Advisory Board. Past member, board of directors of the Texas State Chamber of Commerce, University of Texas Alumni Association, and Texas Alliance for Patient Access. Past president, Rotary of Austin. Also, I know that Tim has served as a legislator for a number of years in the state of Texas, and I know Pat and Tim are founders and members of the board of the John Paul II Life Center in Austin, Texas, which has its vision to build a culture of life in Central Texas, structured around the beliefs of the Catholic faith through medical care, education, spiritual growth, programs, and pro-life activities. I welcome Tim von Dohlen.
Thank you, Mike, and good afternoon to everybody. We're going to take a ride. I'm kind of challenged, like Gene was, to get through all these slides, but we're going to try to do the best we can. Would you go ahead?
How could I have been so dumb? I'm not even married, and I already have kids. Please, please don't be positive. No one can help me. This can't be happening to me. Oh, please, no. Why? What am I gonna do? I have no choice.
The John Paul II Life Center is the parent of the Vitae Clinic. Together, they are to form and provide for a culture of life.
When women come to us in crisis at the John Paul II Life Center, we try to meet them where they are. And we recognize that they face a lot of social pressures and a lot of internal pressures.
And so to have here a holistic medical care for women that treats them with the dignity that they deserve so that they can enjoy the beauty of their fertility. We have, in creating a culture of life, 3 primary objectives. First, to provide cutting-edge medical care to women of all ages and of all faiths. Secondly, to provide sonograms. Third, to provide education for our youth. This is to help them so that they can remain chaste. We follow the ethical and religious directives of the Catholic Church as it relates to health services.
My friends tell me I have to get an abortion because things are just awful with me. And my boyfriend doesn't want the baby. But I really don't want to get an abortion. But everyone is pushing me.
We wanted to get pregnant, and we tried for several years after we got married, and we went through a couple of miscarriages. We learned through the church about naprotechnology and Creighton model, and we really wanted to try that out.
Naprotechnology is the science that allows women to manage their fertility while adhering to Catholic Church teaching.
Dr. Hilger's approach was a much more holistic approach and much more targeted at healing the problem rather than bypassing the problem and trying to force the pregnancy to happen. Probably 2 years after we started with the, learning the Creighton model, that's when we had the twins.
When I first met Mercy, we showed her images of her baby with the ultrasound. She saw how well developed the baby was and the baby's heartbeat. That's when she had some hope for her pregnancy.
The Knights of Columbus in Central Texas banded together many councils here in the Austin Diocese and beyond to raise tens of thousands of dollars to purchase a state-of-the-art 4D ultrasound here in the clinic.
It's just incredible. If someone hasn't seen it, their eyes become wide open when they are able to see these different levels of technology. And it's quite wonderful in recognizing that when a baby is within the womb, it is truly a human being, and it is developing at a rate that we can't even hardly fathom.
It's been shown that once a woman has the opportunity to see and hear the child in their womb, that's much less likely they will ever choose abortion. Saving those lives is so integral to the building of the culture of life.
Unquestionably, we can change Austin to the better and create a culture of life. We are truly the pro-life answer to Planned Parenthood.
Coming here was an answer to my prayer. My baby girl is now 5 months old. She has an older brother and sister. I am grateful that I chose life for my baby girl.
I see a great opportunity here in Austin. I can see this expanding not only in Texas, but in many other states throughout the United States.
This is 7 years of work and 18 months of actually being open. It's a great experience. A lot of challenges along the way. Just to give me an idea, how many doctors do we have in attendance here today? Can you hold your hand up? That's great. If you noticed, as that vine was spreading throughout, it did come over to California. And so we do have great hope for California and for our future. I'm going to go through these slides pretty fast, and those of you who would like to have a set of these slides, if you'll give me your card afterwards, we'll be sure you get one, get a set. I won't have time to go through in great detail, but I'd be glad to do that. So what prompted the formation of the John Paul II Life Center? First, the beauty of the Catholic teaching on the role of woman and man in procreation. Second, Pope John Paul II's writings on the theology of the body. Third, the Catholic Church's commitment to protect life of the unborn. Fourth, the insufficient number of physicians following Catholic ERDs to build a culture of life. Fifth, the need for a visible Catholic program that women see supports their dignity through action. And so it's not just the matter of talking about avoiding abortion, talking about these things, but actually showing through our action that we can help throughout that entire gestational period of a woman's pregnancy and even thereafter. So how do we do what we do? Our mission is to build a culture of life structured around the beliefs of the Catholic faith through pro-life medical care supported by education and spiritual growth programs. We have a vision statement. We want to successfully operate a pro-life medical clinic. We want to work with other medical centers, such as those that are either here or around the country, where we can foster the establishment of other pro-life entities that serve in this manner. We want to help build a culture of life. Our goals are essentially to operate that medical clinic under the direction of a physician OB-GYN as the medical director. Everything we do is in conformity with the teaching of the Catholic Church, following the religious directives. We follow a financial model that we're attempting to get 70% private pay, 30% underinsured or indigent, but at least to get to a break-even level. Those of you who have your own practice, you know that in a year's time you didn't get there. We're not quite there yet, but we're moving in that direction. Secondly, we integrate crisis pregnancy counseling for women. We think that this is an essential part of our mission as well. We operate a sonogram center that serves the patients both in the medical clinic and also for women in pregnancy, and we have separate entrances for our building that does that. We work in conjunction with the Gabriel Project, the diocese, and we provide a system whereby people who cannot pay for a sonogram, we've set up a sonogram to Save the Baby Fund to help so that the center does not have a loss or it's actually able to recover its cost. We offer education for married couples on NFP, including the Creighton buildings, couple lead methods. We have our physician, Dr. Calamarides, who was trained by Dr. Hilders, and we offer nanotechnology, and it's amazing the successes that we've had already. We have a loving, respectful atmosphere and environment that supports the dignity of the woman and her unborn child. And we have a chapel or meditation room, and it's wonderful to see how many patients and employees and others that visit the center utilize that. We do have an understanding with each of our individuals that they sign a statement expressing that they will follow the ethical and religious directives. We arrange for prominent speakers and provide education on various topics that are the subject of our mission. And so our organizational structure is that the John Paul II Life Center is the parent, and the Vitae Clinic or Life Center works hand in hand. We have some unique situations in Texas under Texas law that I'll go into a little bit as to the reasons why we have to do that. We have various criteria for membership, and you'll be able to follow that. We have the responsibilities of our members of the board that have been worked out over a significant period of time, looking at what we were doing and what needed to be done. So what were the hardships and challenges that we experienced in the process of getting open? Well, getting people on the same page is extremely important, and you have a consultant, or you have employees, whoever you have, you've got to sit down and talk about what your purposes are. You got to be on the same page. You can't have separate agendas. Each person has to have the same understanding of your goals. Finding the correct position is extremely important. We utilize, thanks to Steve Coop, the One More Soul website. Getting the hospital to embrace your mission is extremely important. Will the hospital employ your physician, or will you employ your physician? Getting agreement of the bishop. Creating the proper relationship with the hospital. Creating the proper relationship with the diocese. And finding a building that you're either going to lease or you're going to purchase, but having both the proper location and the proper size is extremely important. And this may seem like a strange question, but it was extremely important. When do you actually start raising money to operate the center? You really have to have something that is formidable, established, in order to be able to get people to contribute. So finally open, and that's a picture of Dr. Calamarides, a wonderful young physician. He and his wife have 3 children. We're located in Austin, Texas. Our websites, that's a layout of our floor plan. We actually have 3,350 square feet of space. We have enough space to accommodate another physician. We're hopeful to move in that direction in the near future. The actual steps leading to the creation. We had to create a special legal structure in Texas. You can't just hire a physician in Texas. I think that's the way it is in California too. That structure necessitated the formation of a Texas not-for-profit healthcare organization, which had to be comprised of a minimum of 3 Texas licensed physicians, all of whom would place really their license in jeopardy if things weren't operated properly by that entity. We chose to go ahead and make that entity a 501c3. They essentially turned over the formation then with the physician in a very trusting manner to us, and we were able to move forward and created the John Paul II Life Center itself as a 501c3. What is somewhat unique here is that as with a corporation, you have shareholders and a board of directors. In this situation, you don't have shareholders, but you have a member or members. The John Paul II Life Center is the singular member of the corporation, so that we effectively are the manager for the medical clinic. So that took a considerable amount of time and involvement of the proper individuals. The question of, do you need a OB-GYN or do you need a general practitioner? Even a family practice specialist. Those of you who are physicians know that the payment under various coding responsibilities is different for a OB-GYN versus even a family practice specialist who specializes in OB. And so it's generally best if you have an OB from that perspective. We created a sonogram center. We went out and, with the assistance, as it said in the video, of the Knights of Columbus, we were able to get a $150,000 machine for less than half of that and raised half the money locally and the other half came from the Supreme Council. I think this is a critical element. You have to have a practice management group. How many of you physicians here do your own practice management? I think we've got about 3 or 4. How many of you use a practice manager? Nobody? Well, that's interesting. Well, we were fortunate. Even though the Texas Medical Association is not that pro-life, in this instance, they were really willing to help us, show us how they create their 50 medical clinics across Texas each year. And we were able to utilize those services in a very effective manner from a business perspective. And they helped create the model, financial model for us, looking for a 3 to 5 year pro forma. They had a whole series of other contact individuals where, in effect, it was a one-stop shop. We were able to utilize their contacts to put all the pieces of the puzzle together to make it work. We then created the hospital relationship. And I'll say here that we took an initial approach where we thought we could get the hospital system to be an incubator, to let us create what we thought would work to create this really unique practice. What we found out was that the hospital would engage the physician, but they wanted the physician to practice the way they wanted them to practice, not the way we had a concept of how we want to run the clinic. We spent a considerable amount of time, over 2 years, working on that model, and it just didn't work out. We took a step back, and then we were able to move forward under a physician recruitment agreement, which brought to us the physician with a significant financial assistance from the hospital, with a requirement to pay back the assistance garnered in the first year over the next 2 years, giving the physician an opportunity to have that debt relieved 1/24th per month by continued practice thereafter. And so this really did help us significantly, in excess of $350,000. To obtain physician licensing, y'all know how difficult that is and all the steps that we're required to go through. Again, determining that the proper location was essential. Developing a marketing plan was very important. And so all of that related to the clinic itself. And in the center, we also had those issues to create the 501c3, to hire a person who would run the center, create the affiliation with the Catholic Diocese. And we were extremely blessed to have Bishop Vasquez, who is our current bishop, to work with us hand in glove with everything that was going on, with every step we took to make sure that things were working. We then and currently seek grants from other Catholic and other pro-life foundations. We created the Sonogram to Save the Baby Fund, and we utilized the Knights of Columbus initiative for the sonogram. So what must you consider if you're going to form a physician's clinic and center? Do you want it to be both a crisis pregnancy center and physician's clinic? What size facility do you want, need, or can afford? Do you want a common entrance, a separate entrance, or two completely separate operations? Do you intend to own or lease your office space? Will donated or leased space for the facility meet the ADA, city codes, and other construction requirements? What will you name the center? I think I know what Gene would do if he was naming it. But we thought it was extremely important to connote a pro-life setting and something connected to the Catholic Church. And so we included in our name the name of the Holy Father and our pride and our faith. What will the relationship of the entity be to the Catholic diocese in which the entity is located? Will the entity have a relationship with the Catholic hospital? Will the Catholic hospital offer the physician recruitment agreement or other financial agreement? What type of training and NFP should the physician have? Do you intend to form a 501c3 tax exempt entity? How large should your board of directors be? What are the appropriate considerations in forming the entity's board of directors? Have you developed a mission, vision, and goal statement, and do you have a statement of faith? Has the entity developed obligations and responsibilities for its board members? How does the entity establish its initial budget, select its electronic medical equipment, and get the physician credential? And that's where the practice management group really came into play. What type of sonogram system do you need? How do you determine which company to buy from and how much you should pay? We were very fortunate there to have a consultant who did that for us pro bono, and we found very quickly that Medicus and GE were clearly the leaders in the field, and in light of some of the things that we see with GE, it took us to Medicus. And so, what progress have we made since we opened? A lot of things to share with you there, but we have frequent use of sonogram, which results in the woman choosing life for her baby. And we've seen this at least a dozen times already. It's happening at least 1 to 2 times a month. We continue with the support of the bishop. We had a priest dinner across the city of Austin. Had 37 priests attend. We had 2 physicians who came and shared their story, much along the lines of physician healed and how they got to where they are. And it was very enlightening, quite enlightening for the priests to experience that, and they were very appreciative of that. We did a silver ring thing, chastity event. We were expecting 300. That evening it was raining. We didn't know if we'd have 200. We ended up with 600 and nearly 250 parents. It was an incredible event. The Vitae clinic now has nearly 800 patients. We've had as many as 20 deliveries in 1 month. Patients are coming as far as Dallas, Houston, and San Antonio. That's up to 200 miles away. We have electronic medical records in place. We've developed an additional relationship with the Seton Healthcare Network. And I might say there that Seton, being a part of the Ascension system, is an extremely critical group to work with. We're excited because they right now are working us into their MSO, Management Services Organization for Practice Management. We'll be able to utilize their economies of scale and do other multiple collaborations such as physician referrals. What are our current challenges? Getting the correct patient mix to reach our break-even status, coding limitations to maximize third-party reimbursements, claims collection, the accountable care organization formation, and dealing with where we fit in when you have to have a minimum 5,000 person patient base. We need a Catholic health plan. We need, in light of the HHS contraceptive mandate, how is that going to impact us? It could literally shut us down. So what are the solutions?